Let's talk health now. In Enugu State, the Ministry of Health has confirmed the outbreak of cholera, with 10 casualties so far from the disease. The Director of Medical Services, Enugu State Ministry of Health, Samuel Egwon, who spoke, says steps have been taken to contain the scourge. The state, however, places high alert on patients with symptoms such as severe diarrhea, abdominal cramps, and vomiting. It admonished the people to enhance infection prevention and control measures in their facilities and report cases promptly. The State Ministry of Health announced that it has initiated containment strategies in line with guidelines from the Nigerian Center for Disease Control and Prevention. The State Commissioner for Health, Emmanuel Obi, outlines the importance of preventive actions, including proper hand washing, use of clean water, and practicing safe food handling. For more updates, the Commissioner for Health in Enugu State, Dr. Ekiti Obi, joins me on TVC News at 7. Dr. Obi, what is the latest on the cholera outbreak in Enugu? How many confirmed cases and how many deaths so far?
Okay, good evening, everyone. The way I want to report this is the fact that we have always known that cholera is a disease that has been endemic with us. And this year alone, there has been, a rise and fall in the incidence and the increase in the outbreak in the country. And right now, we're talking about epidemiological weeks of the cholera incidence in the country. For Enugu, we have had 1 or 2 waves, which were very light. Initially, for this 2024 as a whole year, we will say that what we have had is about a total of 60 suspected cases. Now, I say suspected because the most we have are cases that we have diagnosed using the rapid diagnostic test. And then we have not actually gotten a fully confirmed case, but from the symptoms that have been showing, it is highly suspicious of the fact that we may be dealing with cholera, just as is happening in other parts of Nigeria. So we initially had a case in one of our LGAs earlier on in the year. And then about a month ago, there were about 4 suspected cases, which we tried to test for. We have not gotten the confirmed case test result back. We just got 1 RDT positive at that time. But what we are currently dealing with is an upsurge. And in this upsurge, we now have about 55 suspected cases. And to be more specific, what has happened is that within the hospitals where we have been able to carry our surveillance to and to investigate, we have only determined for sure 3 deaths that are highly suspicious of being from cholera. And in all, we have about, from the 55 suspected cases, we have tested with rapid diagnostic test, and we have gotten 18 tested positive from the rapid diagnostic. We have sent all our samples for confirmatory results, and then we have confirmed 3 deaths within the hospitals. And then for the other deaths that were recorded, there were deaths reported within the communities with similar symptoms. And in total, we are talking about 8 deaths within the communities, 3 deaths recorded within hospital facilities. And a total of 55 suspected cases.
I hear you, Doc. And you have mentioned that cholera is endemic with us. But in this case now, what has Enugu State discovered to be the major reason for these increasing cases, and what is being done to contain further spread?
Now, when we talk about reasons, it is important for us to note that, you see, people are highly mobile and they move around. I mean, right now, diseases spread at the speed of travel. So even with the active surveillance that we have been having in place all the while, I mean, it just had to take just the snap of a finger for somebody to travel somewhere and come back and bring back the cholera disease, which is usually transmitted fecal-orally. Somebody contacts it from somewhere, it grows in the body, and then it passes it in stool. Passes it in stool, contaminates water sources, and then, boom, you start to have a lot of other cases as a result of those who probably used similar water sources. So with this upsurge that we're having, we have followed the NCDC guidelines. And what we are doing is that we have activated our Enugu State Emergency Operations Center for Cholera. We have deployed such staff to help in the management of cases in the hospitals where we have localized the highest number of cases. We have deployed state and LGA partners, inclusive of the World Health Organization, other organizations like the Task Force for Global Health, and we have even contacted the Doctors Without Borders, Medicines Sans Frontières, and they have also given us some technical advice already. And then we have massively deployed our own integrated disease surveillance and response, where we are now doing very active case surveillance.
All right, Dr.
We have pre-positioned commodities within these facilities where we're having upsurge of cases. And we're pre-positioned where we're having this upsurge of cases, and we're putting a lot of medication and tests and things in place, hand sanitizers, PPEs, and otherwise.
I hear you, Dr. B. And we don't have much time, so I might just have to leave the conversations. Ekiti is Commissioner for Health in Enugu State. Thank you for talking to us on TVC News at 7.
Thank you. Yeah.
Thank you very much. Well, let's now look at other matters. Some groups in Rivers State are kicking against protests calling for the sack of the project coordinator for the Ogoni cleanup exercise, Nene Barini Zabe. The coalition, comprising youth, student, women, and civil society organizations, says regular change of leadership contributed to the slow pace of the project in the past. In their assessment, the cleanup exercise is now striving to meet timelines and standards under the current management. They, however, appealed for immediate action to implement some of the emergency measures recommended in the United Nations Environment Programme report on Ogoniland.
Sat down and concluded that we don't want removal of project coordinator, because anytime you sack a project coordinator, you set us back three years back, or 6 months back, or 1 year back. And we protested earlier this year around March that Nene Barizabe should be reinstated, and we still stand here that Nene Barizabe will complete his tenure.
We, the Ogoni youth, unequivocally express our unflinching support to IPREP and the cleanup program. We acknowledge Professor Zabe's expertise and professionalism. We condemned divisive tactics aimed at undermining progress recorded at the overall success of the program. We commend Mr. President Ahmed Bola Tinubu for Professor Zabe's reinstatement. And we want to use this opportunity to warn political distractors to stay clear from Ogoni.
It is important for the federal government to quickly make available all resources or support to the current HiPrep project coordinator to ensure that HiPrep immediately begins to set in place the motions to audit the health of Ogoni people. And one thing else we are calling for is for compensation of all impacted communities, of all impacted families.
Transitioning to a more inclusive energy system by embracing renewable energy sources has been recommended to alleviate Nigeria's energy poverty. The recommendation at an engagement on inclusive energy transition in Nigeria was proposed by key players in Oyo, Akwa Ibom State. TVC News' Miriam Daniels reports.
Energy poverty happens when households lack access to affordable, reliable, and modern energy services such as electricity and clean cooking fuels. Data from the World Economic Forum shows that Nigeria has a high rate of energy poverty, with nearly 71% of the population lacking reliable access to electricity. 45% of the population lacking access to the electricity grid, with a large disparity between urban and rural areas. Nigerians have experienced the collapse of the national grid for the 3rd time in a week and the 6th time this year, leaving many in darkness for hours.
If you take a survey, you would also realize that even the middle class who used to cook with gas have now reverted to using firewood and charcoal.
Experts say a well-planned energy transition can help alleviate energy poverty by increasing access to affordable and clean energy.
It is very worrisome that the national grid should be collapsing so frequently, and especially when the government is talking about generating more power.
The only way that can happen is if there is engagement with Niger Delta communities. You have to listen to the communities. You have to understand their needs.
Also know that Nigeria is, a highly indebted country. We are struggling economically right now. Our total debt portfolio stands at 91 billion currently. So it shows that the country cannot do it on its own if we want to transit.
Its achievability, as residents before now enjoyed the comfort of preparing food with cooking gas. But the high cost of the commodity has redirected them to the use of firewood. It is hoped that her plan for an energy transition will be inclusive, affordable, sustainable, and achieve its goal of alleviating the country's energy poverty. Miriam Daniels, TVC News, Uyo, Akwa Ibom State.
TVC News at 7 returns in a moment. Please stay with us. Thanks for staying with us. Wife of Ekiti State Governor Olayemi Oyebanji has empowered another set of 400 people under the Poverty Alleviation Program known as Widows and Orphans Hope Project as part of activities commemorating the second anniversary of the present state government. Dr. Oyebanji, who stated this during the empowerment program in Ado-Ekiti, noted that the beneficiaries include 300 widows, 50 orphans in both primary and secondary schools, and 50 indigent students across tertiary institutions in the state. She appreciated the nation's First Lady, Senator Oluremi Tinubu, and the state government for giving adequate support to the project to enhance food security. In reaction, Governor Biodun Oyebanji promised to assist the WOW project by giving scholarship to vulnerable pupils in council areas in the state.
Selfish life is a useless life. And we must learn to give back to our society. We must learn to give back to people that are not as endowed as we are. We can adopt a widow, an orphan, a less privileged, people with disability. We can adopt one or two and assist them.
The Widows Agent and Hope Initiative, that is WOW, which started as a dream, has become a reality. Through WOW Empowerment Program, we have touched many lives. Prominent among them in October 2023, when we unveiled WOW project, we empower over 400 widows with essential working tools.
To God be the glory to the success recorded in the past year. The projects have made and is still making in the economy. The grassroots of Ekiti State. A special commendation goes to Her Excellency, the First Lady, for her revolved doggedness, compassion, passion, and love in bringing smile to the faces of the widows.
Now to some politics. 700,000, that is the total number of votes being projected for the candidate of the All Progressives Congress, Governor Lucky Aiyedatiwa, in the 16th of November governorship election in Ondo State. At the unveiling of the 700,000 vote target in Akure, Biyi Kpore, who is chairman of the Special Interest Committee of the 2024 APC Governorship Campaign Council, said his committee set the target because it is achievable given the performance of the governor in the last 10 months. The State Deputy Governor, Olaide Adelami, who stood in for the governor at the event, urged members of the Special Interest Committee to embark on a house-to-house campaign. The state chairman of the party, Ade Adetimehin, stressed the need for members of the party to be united.
Our efforts, apart from doubling our efforts in mobilization, in coming out, campaigning and so on, we need to do something differently. What we've probably not been doing before. We need to do neighbor to neighbor. We need to move from house to house. And what we need to do now is to make sure that we go back to our respective local government, our respective wards, and begin to talk to our respective units.
We have 3,933 polling units. What you need to do now, go to each of these units, bring out the best 20 material that can be a good canvasser to give you the result.
We have a target of 700,000 votes for APC. To achieve this is just to have 20 members per unit for mobilization, rather than the usual 10 members. With 200 votes per unit, you can be rest assured we'll have over 700,000 votes. And we want to tell the entire world that Lucky Ayedatiwa is not going just to win this election, he's going to win brilliant.
In the meantime, the People's Democratic Party in Ondo State says it is determined to win the 16th of November governorship election in Ondo State. The chairman of the PDP campaign council in the state, Eddie Olafeso, spoke to journalists in Akure. Senior reporter Ayode Muradeyo brings us details, after which we'll return with business news.
The People's Democratic Party, PDP, is a major opposition party in Ondo State. The party is not leaving any stone unturned in its bid to capture the state in the November 16 governorship election. The PDP had last week launched its campaign in Akure with national leaders of the party in attendance. At the well-attended rally, leaders of the party expressed the need for members to close ranks and adopt aggressive campaign strategies. The party's campaign committee chairman, Eddie Olafeso, is optimistic that the PDP will get it right and dislodge the ruling All Progressives Congress APC from power. Olafeso said the party is in the race to win and urged the electoral body to be neutral.
We have sensitized our people. Our party is very united. We are committed to hard work and ensuring that we follow the rules of the electoral campaigns, and we are very confident that we are going to win the November 16 election. Right. I'm telling you that today we are going to Akure North, tomorrow we'll be in Akoko Northwest and Northeast, and by Thursday we will be in Odugbo. Our plate is full. Our people are eager to hear our messages, and we are resonating with them. We are all in the same boat that there must be change in Ondo State.
The PDP says to adopt strategies to ensure victory in November. Ayode Muradeyo, TVC News, Akure.